There is something happening tonight in homes across this country and around the world that most people have absolutely no idea is putting their lives at risk. Not a disease spreading through the air, not a contaminated food supply, something far more invisible than that. Something happening in the one place every single person believes they are completely safe, their own bed. Right now, as you watch this, millions of adults over the age of 50 are going through their evening routines, brushing their teeth, setting their alarms, pulling back the covers, completely unaware that the habits they are practicing tonight are quietly creating the conditions for a heart attack or stroke while they sleep. And I want to be very direct with you. This is not a dramatic title chosen for clicks. This is not exaggeration dressed up as health advice. The American Heart Association has compiled decades of research confirming that nearly half of all fatal cardiovascular events in older adults occur between the hours of 10 p.m. and 6 a.m. Nearly half, while people are asleep, while they believe their bodies are resting and healing, while their families are right down the hall. That statistic stopped me cold the first time I truly absorbed it, and it should stop you too. Because it means that for a huge portion of the people who suffer fatal heart attacks and strokes, the most dangerous moment of their entire day is not the drive to work, not the stress of a difficult conversation, not the physical exertion of exercise. It is the quiet, seemingly safe act of going to sleep. My name is Dr. Julian Cross, and I have spent many years in clinical practice helping older adults understand and protect their cardiovascular health. I've sat across from patients who survive nighttime heart attacks by the narrowest of margins. I've had conversations with families trying to make sense of how a loved one went to sleep and never woke up. And in case after case, when we looked carefully at the patterns, the same habits kept appearing. Ordinary habits, habits the patients had never once imagined were dangerous. Tonight, I am going to walk you through 5 of the deadliest nighttime habits affecting adults over 50. I will explain exactly what each one does to your cardiovascular system while you sleep, and I will give you a clear, practical, protective routine you can begin using tonight. Not next week, tonight. Before we go further, one essential note. Everything I share today is educational information grounded in peer-reviewed research. It is never a replacement for personalized medical care. If you have cardiovascular concerns, existing heart conditions, or uncontrolled blood pressure, please work closely with your physician. Now, let's begin. Why sleep becomes a danger zone after 50. To understand why certain nighttime habits are so dangerous, you first need to understand what a healthy cardiovascular system is supposed to do during sleep. Under normal, healthy conditions, sleep is a remarkable period of restoration for your heart. Blood pressure drops by 10 to 20% in what physicians call the nocturnal dip, a crucial protective mechanism your body has developed over a lifetime. Your heart rate slows. Your nervous system shifts out of its active, sympathetic fight-or-flight mode and into its calm, parasympathetic rest and recover mode. Your blood flows smoothly. Your arteries experience relief from the pressures of the day. Your brain activates systems that clear out metabolic waste products that have accumulated during your waking hours. This is what sleep is designed to do. This is what your cardiovascular system is counting on. But after the age of 50, the margin for error narrows considerably. Your arteries have lost some of their youthful elasticity. Decades of inflammation, dietary choices, and natural aging have left their mark on your vascular walls. Your heart's electrical conduction system becomes slightly less stable. Your body's ability to regulate blood pressure and circulation becomes less precise. This means that when something interferes with that nighttime restoration process, when a habit disrupts the protective mechanisms your cardiovascular system depends on, the consequences are far more serious than they would have been at 30. The body at 50, 60, or 70 has less reserve capacity, less room to absorb stress, less ability to recover from disruption without incident. And here is what makes this so dangerous. These disruptions happen while you are unconscious, while you are completely unaware. Your blood pressure can spike dramatically during the night and you will feel nothing. A dangerous clot can begin forming in a narrowed artery, and you will have no sensation of it. Your heart can labor under enormous stress for hours, and you will sleep right through it, until you can't. Now let's talk about the 5 habits driving this invisible danger. Deadly habit 1. Eating late and eating heavy. Let me ask you something honestly. What time did you eat dinner last night? And how much did you eat? For many adults, dinner happens late. Life is busy. The family schedules don't align. Work runs long. And by the time the evening meal finally comes together, it's 8, 9, even 10 o'clock at night. A full plate, maybe seconds, perhaps a dessert. Then, an hour or so later, bed. This pattern feels completely normal. It's just dinner. Everyone has to eat. What possible harm could come from it? After the age of 50, the harm is substantial, and it begins the moment you take your first bite. When you consume a large, heavy meal, your digestive system demands a dramatic increase in blood flow to process everything you've eaten. Your stomach, intestines, liver, and associated digestive organs all require significantly more circulation to do their work. Your heart, responding to this demand, must pump harder and faster. Your blood pressure rises, often sharply. Your metabolism accelerates at the exact moment it should be preparing to slow down and rest. Now imagine this process beginning at 9 p.m. Your heart is working overtime. Your blood pressure is elevated. Your digestive system is in full active mode. And an hour or two later, you lie down to sleep. Instead of entering that protective nocturnal dip, that restorative low-pressure rest state your cardiovascular system needs, your heart continues laboring. Blood pressure remains elevated. Triglyceride levels in the blood rise as late-night dietary fats enter circulation, promoting arterial inflammation. And this condition persists not for 30 minutes, but for hours, the entire duration of your sleep. A major longitudinal study published in the European Heart Journal followed over 100,000 adults tracking their mealtime patterns and cardiovascular outcomes over several years. People who ate their final meal late in the evening showed a substantially higher rate of nighttime heart attacks and strokes compared to those who finished eating earlier. This was not a marginal difference. It was a clear, significant, measurable elevation in life-threatening events, directly tied to the timing of the evening meal. There is another mechanism at work here that most people never consider. Going to bed with a full stomach significantly worsens acid reflux. And acid reflux is not simply an uncomfortable digestive issue. When stomach acid rises into the esophagus, it can directly stimulate the vagus nerve, a major nerve that runs between your digestive system and your heart. Vagal stimulation in older adults can trigger dangerous arrhythmias, irregular heart rhythms that in a compromised cardiovascular system can escalate rapidly into something far more serious. I remember one patient clearly, a woman in her late 60s who had eaten large, late dinners her entire adult life. It was simply how her household ran, how she was raised, how the rhythm of her family worked. She never once associated it with any health risk. One night, she suffered a significant heart attack in her sleep. When we examined her history carefully, it became clear that her heart had been under sustained nighttime stress for years. The habit that felt completely ordinary had been quietly compounding cardiovascular damage across decades. The correction here is straightforward. Aim to finish your evening meal by 6 or 7 p.m. whenever possible. If your schedule doesn't always allow that, focus at minimum on keeping the evening meal light and easy to digest. Lean protein, cooked vegetables, modest portions. Avoid heavy fats, large quantities of sodium, and oversized portions in the evening hours. Give your heart the gift of genuine rest during the night. It has earned it. Deadly habit 2, skipping medications or taking them at the wrong time. If you take prescription medication for blood pressure, cholesterol, or blood thinning, please give this section your complete attention. What I am about to explain could genuinely be the difference between waking up tomorrow morning and not. Your blood pressure follows a natural daily rhythm. During active daytime hours, it rises to support movement, metabolism, and the demands of waking life. During sleep, it should fall significantly into that protective nocturnal dip. In a healthy cardiovascular system, this rhythm operates smoothly. But in many adults over 50, particularly those with existing cardiovascular risk factors, this rhythm is disrupted. Blood pressure does not drop adequately during sleep. In some cases, it actually rises during nighttime hours, a condition called nocturnal hypertension. Your arteries, already potentially narrowed by years of plaque accumulation and age-related stiffening, face hours of sustained elevated pressure during the very hours they were supposed to be recovering. This is an extraordinarily dangerous combination. Elevated nighttime blood pressure pressing against vulnerable arterial walls can rupture unstable plaque deposits that have built up over years. It can cause fragments of plaque to break free and travel through the bloodstream. A fragment reaching the coronary arteries causes a heart attack. A fragment reaching the cerebral circulation causes a stroke. And because you are asleep, there is no warning you will consciously register, no pain that will wake you in time to call for help. Research published in The Lancet, one of the most respected medical journals in the world, demonstrated that properly timed cardiovascular medication can reduce nighttime heart attack and stroke risk by nearly 50%. Not a different medication, not a higher dose, simply taking the same medication at the optimal time of day for nighttime cardiovascular protection. Conversely, missing doses, even occasionally, allows dangerous pressure spikes during sleep that you will have absolutely no awareness of. Many patients I have worked with over the years treated their blood pressure medication casually. They forgot a day here and there. They figured the body could handle it. One of them suffered a massive stroke during one of those unmedicated nights. He survived, but with permanent neurological damage that changed the entire trajectory of his life. What felt like a minor oversight was anything but. If you take cardiovascular medications, this is not an area where flexibility or inconsistency is acceptable. Take your medications at the same time every day as directed by your physician. Ask your doctor specifically whether your medications are optimally timed for nighttime cardiovascular protection. Use pill organizers, phone reminders, alarm systems, whatever structure you need to ensure perfect consistency. Your life depends on this discipline in a way that is entirely literal. Deadly Habit 3: Undiagnosed or untreated sleep apnea. This is the habit that surprises people most, because the people who have it often don't know they have it, and those who do know frequently underestimate how seriously it is threatening their heart. Sleep apnea is a condition in which your breathing repeatedly stops and restarts throughout the night. These pauses, called apneic episodes, can last anywhere from 10 seconds to 30 seconds or longer. During each episode, the oxygen level in your blood drops, and each time that oxygen level drops, your body triggers an emergency physiological response. Research from institutions including Johns Hopkins, Harvard, and Stanford has established that untreated sleep apnea triples the risk of nighttime heart attack and quadruples the risk of stroke. These are not modest statistical increases. These are profound, life-altering elevations in risk, occurring night after night in people who believe they are simply sleeping. The warning signs are specific and recognizable. Loud, chronic snoring that disturbs a bed partner or can be heard from another room. Waking suddenly, gasping for air, or feeling like you are choking. Persistent morning headaches. Extreme daytime sleepiness, regardless of how many hours you spent in bed. Blood pressure that remains stubbornly high despite medication. Waking frequently with a dry mouth or sore throat. A patient of mine, a woman in her early 70s, thought her snoring was merely an embarrassing quirk her husband had learned to sleep through. She had no idea she was stopping breathing repeatedly throughout every night. During a particularly severe episode, her oxygen levels dropped so dramatically that her heart developed a dangerous, chaotic rhythm. Her husband recognized that something was catastrophically wrong and called for emergency help immediately. She survived. Treatment with CPAP therapy Continuous positive airway pressure transformed both her cardiovascular health and her quality of life almost immediately. If you recognize these warning signs in yourself or someone you love, please pursue evaluation. Sleep studies can now be conducted at home in many cases. This is not about snoring being annoying. This is about preventing catastrophic cardiovascular events during sleep. A diagnosis followed by appropriate treatment can be genuinely life-saving. Deadly habit 4, going to bed dehydrated. While you sleep, your body continues losing water continuously. Every exhaled breath carries moisture out of your body. Perspiration continues even when you are not noticeably sweating. Normal metabolic processes consume fluids throughout the night. If you began the night already mildly dehydrated, your circulatory system enters those long, vulnerable hours at an immediate disadvantage. Here is what happens inside your body. When blood volume decreases due to dehydration, the blood itself becomes more concentrated, thicker, more viscous. This is not metaphorical. This is a measurable physical change in the consistency of your blood. Thicker blood flows more slowly through blood vessels. It encounters more resistance. It requires more pressure to circulate. And critically, slower moving, more viscous blood clots far more readily than properly hydrated blood. The cellular components of blood have far greater opportunity to aggregate and form dangerous clots. Now combine this thickened blood with the natural physiology of sleep, when your heart rate slows and your circulation naturally decelerates. Blood flow to your heart muscle and your brain can become critically reduced. The conditions for an ischemic event, tissue damage from inadequate blood flow, become alarmingly favorable. A comprehensive study in the Journal of Cardiovascular Disease found that even moderate dehydration, not severe, not extreme, simply moderate, raised the risk of nighttime cardiovascular events by over 60%. More than half again is likely to suffer a heart attack or stroke during sleep from a habit adopted to avoid bathroom trips. I worked with a 70-year-old patient who told me proudly during a routine visit that he had eliminated his nighttime bathroom wakings entirely by not drinking anything after 6 p.m. He considered this an achievement. He suffered a stroke in the early morning hours caused by a clot forming in a major cerebral artery. Blood work revealed his blood was unusually concentrated. Dehydration had created the perfect conditions for that clot to develop. The solution is simple, free, and immediately protective. Drink 1 full glass of water approximately 1 to 2 hours before your planned bedtime. This timing allows your body to process the fluid and eliminate excess before you lie down. Use the bathroom immediately before getting into bed. Keep a glass of water on your bedside table for small sips if you wake feeling thirsty during the night. Small sips, enough to address thirst without requiring another bathroom trip. This single habit keeps your blood flowing at the right viscosity throughout the night, protecting both your heart and your brain during the hours when they are most vulnerable. Deadly habit 5, sleeping in a room that is too hot or too cold. This is the habit that generates the most surprise when I discuss it with patients, because almost nobody connects bedroom temperature to heart attack risk. And yet the research is clear, compelling, and consistent. Your bedroom temperature directly affects your cardiovascular system throughout the entire night. Not your comfort, your cardiovascular function. When your bedroom is too warm, your body works continuously to release excess heat and maintain its core temperature within the narrow range required for survival. Blood vessels throughout the body dilate to bring more blood to the skin surface where heat can escape. Your heart rate rises to pump this increased volume through a dilated vascular system. You lose fluid through perspiration, even if you don't wake up drenched. This fluid loss compounds the dehydration danger we just discussed. Your cardiovascular system remains under thermal stress, elevated heart rate, elevated blood pressure, for the entire night, rather than entering the restorative, low-stress mode it needs. Research from Harvard Medical School found that sleeping in rooms above 75 degrees Fahrenheit significantly increased nighttime cardiovascular risk in adults over 50, particularly those with existing heart conditions or risk factors. Your heart is laboring all night to manage heat stress when it should be resting. But the opposite extreme is equally dangerous, through entirely different mechanisms. Cold temperatures cause blood vessels to constrict automatically, narrowing to conserve core body heat. This is a reflex your body performs without your input or awareness. This widespread vasoconstriction dramatically increases vascular resistance, the pressure your heart must overcome to push blood through your circulatory system. In older adults whose arteries are already stiffened by decades of atherosclerotic change, this added resistance can be the final trigger that precipitates a cardiac event. European cardiovascular data has documented sharp increases in nighttime heart attacks and strokes during cold months, particularly among older adults. This correlation is not coincidental. Cold-induced vascular stress during sleep is a genuine and measurable cardiovascular danger. The optimal cardiovascular protective sleeping temperature range is 65 to 70 degrees Fahrenheit, approximately 18 to 21 degrees Celsius. Within this range, your heart rate remains stable and low, blood pressure regulation improves, and the protective nocturnal dip occurs normally. Sleep architecture deepens, with more time spent in the restorative deep sleep and REM stages, where the most meaningful cellular repair takes place. Your body does not divert energy and cardiovascular resources toward managing thermal stress in either direction. This is not about what feels most comfortable. This is about what protects your heart while you sleep. Invest in a simple room thermometer. Adjust your heating or cooling, use fans, add or remove blankets, whatever is necessary to maintain that protective range consistently. Your cardiovascular system will thank you in ways you may never directly see, but will absolutely benefit from. The heart-safe nighttime routine, starting tonight. Now that you understand each of these 5 dangers clearly, I want to give you something practical and immediately actionable. A step-by-step evening routine that systematically addresses every risk we have discussed and creates optimal conditions for cardiovascular safety during sleep. You can begin this tonight. 6 to 7 p.m., the early dinner window. Eat a light, easily digestible evening meal during this window. Focus on lean proteins such as fish, chicken, turkey, or plant-based alternatives. Include fiber-rich vegetables. Choose easily digestible carbohydrates if you include them. Sweet potato, quinoa, or rice work well. Actively avoid heavy fats, excessive sodium, processed foods, and oversized portions. Finishing dinner by 7 p.m. gives your digestive system 3 or more hours to complete its heaviest work before you lie down, allowing your heart to rest rather than labor during your sleeping hours. 7 to 7:30 p.m. Strategic hydration and medications. Drink 1 full 8-ounce glass of water. This is your intentional nighttime hydration, timed early enough that your body can process it before bed, but late enough to maintain proper blood viscosity through the night. If your physician has prescribed cardiovascular medications, particularly blood pressure medications, take them exactly as directed during this window. Set a phone alarm if you need a reminder. Use a pill organizer to track consistency. Never treat a dose as optional. The protection these medications provide during the nighttime hours is not something your body can substitute for on its own. 8 to 8:30 p.m. Calm transition period. This hour is your signal to your nervous system that the active day is ending. Engage in genuinely calming activities. A slow, gentle walk around the neighborhood. Reading a physical book. Listening to quiet music. Deliberately avoid emotionally charged conversations or unresolved conflicts during this window. Avoid intense screen exposure that keeps your brain in a stimulated, reactive state. Avoid anything that elevates your heart rate or stress response. This is your body's transition from sympathetic to parasympathetic mode, and protecting this transition is important for the cardiovascular rest that follows. 9 to 9:15 p.m. Prepare your sleep environment. Now actively create the conditions for cardiovascular safety in your bedroom. Check the temperature and adjust it to the 65 to 70 degree range we discussed. Use a thermometer. Don't guess. Place a glass of water on your bedside table. Dim or eliminate bright lighting to support your brain's melatonin production. Ensure the room has adequate ventilation. A stale, poorly oxygenated room affects both sleep quality and cardiovascular function throughout the night. 9:30 to 9:45 p.m. Final preparation. Make a thorough bathroom visit before bed. Empty your bladder as completely as possible to minimize nighttime wakings that interrupt your cardiovascular recovery. Complete your normal bedtime hygiene routine. Take any remaining medications specifically prescribed for right before sleep. 10 p.m. Sleep position and rest. Your sleeping position carries more cardiovascular significance than most people realize. If you snore, if you have been told you stop breathing during sleep, or if you have diagnosed sleep apnea, sleep on your side rather than your back. Side sleeping helps keep the airway open and reduces the frequency and severity of breathing disruptions. Support your neck with appropriately sized pillows, not so high that your airway is bent, not so flat that your spine is misaligned. If you wake during the night for any reason, move deliberately and without rushing. Sit upright for 30 to 60 seconds before standing. This pause allows your cardiovascular system to adjust blood pressure gradually and prevents the dangerous drop in pressure that can cause falls, particularly dangerous in older adults. Take small sips of water if you feel thirsty. If you need to use the bathroom, use night lights so you are never moving in complete darkness. When this routine is followed consistently, research examining circadian blood pressure patterns and nighttime cardiovascular safety suggests that nighttime cardiovascular stress can be reduced by more than 40%. Not from any single change in isolation, but from the cumulative effect of systematically removing each of the 5 dangers we discussed. What you now know, and what to do with it. Let's be clear about what you have just learned. Habit 1. Late, heavy dinners. Forces your heart to labor overnight instead of rest. Correct it with earlier, lighter evening meals. Habit 2. Inconsistent cardiovascular medications. Allows silent nighttime pressure spikes that rupture plaques and cause strokes. Correct it with perfect, consistent timing. Habit 3. Untreated sleep apnea subjects your heart and brain to repeated oxygen deprivation every single night. Correct it with proper diagnosis and prescribed treatment. Habit 4. Going to bed dehydrated. Thickens the blood precisely when circulation is naturally slowing. Correct it with intentional pre-bed hydration. Habit 5. Poor bedroom temperature control. Keeps the cardiovascular system under thermal stress when it should be deeply resting. Correct it by maintaining 65 to 70 degrees consistently. Because it means that the actions you take tonight, this evening, before you go to sleep, carry genuine protective weight. The dinner you eat at 6:30 instead of 9, the glass of water you drink before bed, the medication you take consistently instead of skipping, the thermostat set to 68 degrees, the doctor's appointment you schedule to discuss sleep apnea. These are not small gestures. These are acts of self-preservation. Your heart has been faithful to you across every decade of your life. It has beaten without rest, without complaint, through every moment of joy and grief and ordinary day you have ever lived. It has never asked for anything except the conditions to do its work. Tonight, give it those conditions. Start the routine, make the changes, not from fear alone, but from understanding, because you now know what your heart needs, and you have the power to provide it. I would love to hear from you in the comments. Which of these 5 habits surprised you most? Which change will you make first tonight? Share your commitment below. Your words may be exactly what someone else needs to take action. If this video helped you, please subscribe and share it with someone over 50 you care about. A parent, a spouse, a close friend. You may never know whose life you protect by passing this information forward. I'm Dr. Julian Cross. Sleep should restore you, protect you, and strengthen you. Starting tonight, let's make sure it does exactly that.